NTV.
Welcome back to Morning at NTV, and thank you for staying with us. Our next segment is the Kickstarter. We're going to be talking about the medical workers on the front line. You've seen the medical practitioners in Italy. You've seen the medical practitioners in the UK, in the United States. The main conversation now is that we do not have enough beds, we do not have enough ventilators, we do not have enough space. Patients who have minor ailments are being sent home so that they can create room for other people with serious ailments with regards to COVID-19. In Uganda here, how prepared are the medical practitioners as the world further shuts down in the wake of the coronavirus pandemic? Yes, more cases are now being recorded outside of China, where the virus was first detected in the central city of Wuhan than outside. Uganda now has 9 coronavirus cases, and it is in a partial lockdown with some students at home and workers being encouraged to stay home. However, there is a constituency on no one is mentioning that is the private medical practitioners who in most cases may come in contact with COVID-19 suspects as first responders. To talk to us about this and more, we have the president of the Society of Uganda Private Medical Practitioner, Dr. Lulume Baiga. Now, before we get into the conversation, I have some breaking news for you. Out of all the 196 countries all over the world that are being affected by the coronavirus, one country has not been affected, and guess what? That is Antarctica. No one goes there. And that is good news for them. Antarctica hasn't recorded a single case of the coronavirus. But I have Dr. Lulume Baiga right here in studio. Thank you for joining me right here on Morning at NTV. Very good morning.
Good morning.
How are the medical practitioners handling the whole COVID-19 case? How is the whole situation? But then first, we would like to understand the coronavirus from a perspective of a medical practitioner. I, as a journalist, have been trying to, do my own research and trying to disseminate to the viewer right there what they need to know about COVID-19. But that's just me, Romeo Busiku, as a journalist. But then we had to take it upon ourselves to get an expert and get your opinion on issues like, is the coronavirus airborne? Is the coronavirus, can you transmit it through oral fecal? Some of those questions, many of them. But then first of all, we would like to know, from your perspective, how the coronavirus is mutating and how it has evolved since last year, December.
Thank you very much for those questions, and they're very important for our listeners and viewers. The World Health Organization has defined this disease as airborne. And airborne diseases are inhaled, they are under respiration. Apart from inhalation of the disease, of the germs, of the virus, which is described to be in the atmosphere, in the air, for over 8 hours, or can be attached to a solid object for 2 to 4 hours.
Which can even stay longer on cardboards for 24 hours. That's what I was hearing, and I was even scared.
And a lot of studies are going on, of course, in order to characterize what this one is and whether it mutates or not, changing form. And those interesting studies, we are anxiously waiting for the results. But defining COVID-19 as an airborne disease makes Uganda very, very vulnerable to it.
How?
Because this is a disease which you can get from open air. Social distancing has not been part of us. And when you do social distancing in our setting, it's something new. The use of masks becomes very important. Actually, life-saving, extremely important. But here, even when you have masks, you may find people finding it difficult. They think that they are gagging themselves. The mode of transport. We have a border dominated public transport.
Over 1 million young people in that business.
They are moving all over the place, unprotected. Those are the riders. What about their passengers? Some of them carry 2 or 3. In an airborne disease, it can cause a catastrophe. Look at our commuter taxis and buses. You can't maintain a social distancing of a meter in a taxi. It's quite impossible. I think Cabinet is going to discuss it today. But what saves people would be a mask. And masks are becoming very expensive. And this is one of the gist of the matters that I wanted this conversation to engage. If this is an airborne disease, and we shall inherit, and people sneeze irresponsibly, speed irresponsibly, and so on and so forth, they need to be taught so that they have behavior change. And then we must protect ourselves using a facial mask. I saw a conference in Europe. Everybody was masked. In other words, everybody is suspicious of another. Nobody can be safe without a mask. A mask was about 700 shillings in Kampala. Now it is 6,000. If at all we must implement the public health measures, then how are people going to afford it? It makes government to come in, either to industrialize the production of masks and of course propagate the use of masks, or prevents those people who want to make business out of a bad situation. So as private practitioners, we get concerned, and we are the frontliners. People go into private practice before they go to public hospitals. We are saying, how are we going to be engaged? We are not engaged. We are simply faced with a situation in which government is trying to grapple around how they can use their own systems without engaging the private sector, which sees over 55% of the people seeking health care. Now, we shall be talking about testing services. How do we test people? Can't the huge number of health units be able to assist government in taking off samples at least? Somebody presents with a flu, temperature, and so on. Yes, COVID is there, but it doesn't prevent you from getting common cold. So can we take a sample? We monitor you from our localities, because usually private clinics have areas, people who, the catchment near to them. So government needs to look at this kind of partnership, very importantly, to see how we can come in, especially in research. If at all laboratory equipments are not available, they are being taken to regional referral centers, which are definitely far from the majority of the population. How do you make use of private practitioners in their localities in order to get for you samples to the other centers, so we can follow up people who could be infected with this disease? So these are the conversations that we need to have.
Dr. Lulume Baiga, I'm telling you, it's a very, very serious situation that we are dealing with. The COVID-19, 422,000 people infected globally and 18,000 deaths. In Uganda, we are having only 9 confirmed cases so far. So when it comes to testing, many countries are saying just because you do not have more cases, it doesn't mean they are not there. It simply means you're not testing to find the right people who might have contracted the disease. Now, help us understand how best this government can go ahead and implement a nationwide testing exercise to ensure that everyone is tested and those people with the disease are sifted out and isolated. How best can they go about that?
I think they are rolling out what I saw on television last night. The Deputy Minister for Health confirmed that they're trying to roll out. I had been informed previously that they had over 60,000 testing kits which were donated, and I was trying to inquire where are they, so we can be able to facilitate the process. I think they are trying to roll out to the regional referral hospitals where patients can be referred. But the regional referral hospitals also serve a very big catchment, as you know. And you would wish that these kind of services are brought closer, less congested areas, and where professionals can help them too. That is how I think the linkage between the private sector and the government facilities needs to establish a nexus under which all can be engaged and all can help. But there is something else that has come on. We, on the grassroots, we are hearing people calling us. They want to stockpile chloroquine simply because they had it from President Donald Trump, the United States President.
Now, help us, demystify that myth. Does chloroquine actually cure coronavirus, in your opinion?
You see, this is a brand new disease, according to an expert in the UK who was appearing with the Prime Minister of the UK. So this is a brand new disease, and is an expert, a professor at that, virologist. All of a sudden you hear the President of the US saying chloroquine has been found to be curing the disease.
Even here in Uganda, chloroquine is no longer existent in our pharmacies.
In Uganda, it is obsolete. We were using it to treat malaria. I don't know whether people have been accessing it.
Actually, it was still on the shelves. You'd still go to a pharmacy and ask for chloroquine and you'd get it.
To treat what?
To treat malaria. So right now, as Trump touted the medicine last week, I went there over the weekend to do some investigations, and most of the pharmacies had run out of chloroquine. People
I am told
to get those drugs.
That a tin of chloroquine, which was 60,000, had to go to 250,000.
I'm telling you.
But then again, is it for prophylaxis? You know, prophylactic treatment, you give yourself treatment so that in the event you should have got this disease, you already have the treatment inside you.
That's what happened to a couple yesterday in the United States. They wanted to do that prophylactic thing.
Who told them
take the medicine so that when the disease finds them, they finds them
the point
with
is,
a high immunity. They ended up dying. One of them.
This is community anxiety, and the Ministry of Health, as the leading agency, needs to calm this anxiety. Who told Ugandans that this is prophylactic treatment? In what doses are medical practitioners going to prescribe chloroquine to treat COVID? By the way, who would have tested and found them to be having COVID so that they prescribe chloroquine? In what doses? All this anxiety we are getting into is going to poison people. People are going to start eating drugs without any guidelines, no guidance at all, without allaying this kind of anxiety, and the population is restive.
Help them understand the dangers of self-medication.
So self-medication they know, because you can. You have just given an example. But as the lead agency, the Ministry of Health, and the President, who has taken it to himself to be explaining some of the things to the population, needs to come out to allay the anxiety of the people and stop people from rushing to purchase chloroquine. Because you might get a flu, you might get a cold, and then you start packing yourself with chloroquine, you may end up dying. I don't know if at all those chloroquines on the shelves today, which were rendered obsolete in the treatment of malaria, are still within the shelf time. They could have expired long time ago, and unscrupulous people could use this chance in order to exploit the masses by getting money out of them. So this one is a very important public health concern that we have recognized, and we think that government needs to come in. Then there are other things which have also skyrocketed in prices, and they are disabling the private practitioners. For instance, we now need to upgrade our temperature monitoring systems, not through the non-contact thermometers using infrared beams. But it was about 72,000. Now it is 240. Yet these are important things, gadgets which you can use in order to help people without having to contact them. I mean, we need to reduce contact as much as possible using technology. But when they are becoming too expensive for smaller private practices, then people will maintain on the medieval types. For me, if there is an investment that the government of Uganda can do,
Yes.
is to help lift the standards of these private practices, which are many, and the frontliners, in order to lift them, to help them to upgrade their practices. It will help them. Gloves. The price of gloves has skyrocketed. These are protective gears that are needed. Okay? And of course, the partnership that I talked about, that the Ministry of Health, maybe Uganda Virus Research Institute, and the central laboratories which are doing the testing need to couple up with private practitioners in order to improve more on the diagnosis.
And the diagnosis.
Maybe many people out there have COVID already. Who knows?
Because we are dealing with the 84 passengers that we are still tracking who were with the man who was isolated on Saturday with COVID-19. And we emphasize that maybe he might have spread the disease to these people who might already be spreading the same disease to the society. But then we got some relief. Yesterday, the Jack Ma Foundation sent us some kits, 100,000 masks, 20,089 test kits, and 141 personal protective gear. Now, speaking of protective gear, in the United States, I had a press conference yesterday from the governor, that is Andrew Cuomo of New York. He was saying that they have only 7,000 ventilators, and they need more, 140,000 beds to combat the spread of the COVID-19. Coming back to Uganda, this is a very, very good question. How prepared are our medical practitioners to take on a very huge outbreak of COVID-19? Are we ready? Do we have the resources? Do we have the ventilators? Do we have the beds? Remember, we have only 55 ICU beds. A developed country like the United States is calling for 140,000 more beds to handle the issue of COVID-19. How prepared are we in that regard?
It should be an obvious catastrophe if at all we have that kind of outbreak in Uganda. And it can be disastrous. I mean, many people would die, definitely would die. We have been talking about ICUs. Per 100,000 people, you would need at least 10 beds. So you can calculate how many beds or ICU beds that you need in Uganda. We are comparing ourselves with other countries, including Italy, where I saw the Prime Minister weeping. The Prime Minister wept. Very unfortunate. So we are definitely, readiness is a very...
what don't we have and what do you need?
We almost have nothing. We have 55 ICU beds.
How many more beds do you need?
10 beds per 100 persons. That's what the prescription should be. So, how many millions do we have?
42.
We can do simple arithmetic and we see how many hospitals each of the referral hospitals, how many ICU beds you should be having. Should be many.
How many ventilators do you need? The governor of New York has 7,000 ventilators, has 7,000 ventilators. He needs 30,000 more ventilators.
Suffice it to
Trump
say,
only gave him 400 ventilators and he started arguing.
Suffice,
I need 30,000, you're giving me 400. What do you mean? In Uganda, how many more ventilators do we need? Just in case of a big outbreak.
That is if at all we have any. Anyhow,
do we even have ventilators?
Negligible. We have negligible capabilities for intensive care in Uganda. Negligible. So we are a population that would depend and should depend on God for the time being until we start to realize that health care is an important thing. We are being rudely awakened. It is a rude awakening to all countries all over the world to improve their healthcare delivery system. And for Uganda, it is extremely rude. But, you know, at the moment, I think people are calm. They welcomed the president. The president's speech and the guidance that is going on giving to the country. That is good enough. Everybody listens because this is something that calls all of us to listen and get leadership. We are now making proposals for government to continue to absorb some other ideas that can be integrated in order to contain a situation that we are anticipating. In future, we shall be engaging governments, any other government, maybe not this one, maybe another government will be there, on how to ensure that health care delivery system is improved from the scratches to something, and from something to something better. The US has been rudely awakened. It's the greatest economy. The UK has been awakened rudely. India, Italy,
1.3 billion people.
the Prime Minister wept of Italy. Those are the safe havens
because
humanity can have.
The medical practitioners who are dying on the front line, and that is the basis of this whole conversation. After the announcement of the 8 cases on Monday, it shook the country, and people were asking questions like, what could we have done better?
Now, we must make a deliberate investment. This population that we are dealing with would prefer to have a meal than have a face mask a day. A face mask is 6,000 now in a pharmacy. If at all you tell somebody to put on a face mask and he needs food, what is going to be his priority? It's going to be food. That is how safety nets need to come in. People have been advising government to release some of the social security fund for those people who have saved. Children at home, they need food, they need to be fed, they need health care and so on. People need to pay their bills, they need to pay electricity, they need to pay water and so on. But now they also need protective gear. This is how governments need to come in. And if at all there is no readiness on this, then it can be explosive. Yes, but if our government, apart from these guidelines, we need a direct investment in something. Can we invest in the fabrication of these face masks and have them widely distributed, especially to the vulnerable populations, the traveling populations, okay? 2, can we engage more in testing, engage these private practitioners, buy equipment, equip them, let them participate, isolate cases and report cases. Can we do that? Or we are just leaving it for laissez-faire attitude? Okay? What about sanitizers? Yes, the private sector is taking on the manufacture of, and there is a wave, I think,
yes,
on spirits.
They are going
That's
to work
good,
on that, yes.
but it's not good enough. You need more investment in that because the measures are of public health nature and we need to be proactive. Okay?
Not reactive.
Not reactive. Then these guidelines which could destroy our people that I'm talking about, people are buying this drug, stocking this, stock that, and so on. Come forward and say, this is what works, this may not work, and so that the anxiety of the people is allayed, including the protective gears for beginners, gloves. These skyrocketing gloves prices is going to feed into really a bigger catastrophe if at all we are not protected. Yes, and continue to sensitize the population, about social distancing, hand washing, yes, and basic hygiene generally. I think there we can go on reviewing with time and we see what we can do better and what we can copy from elsewhere. I was gratified that the president followed the advice some of us have been giving. It should have been done earlier. Closure of the borders to countries, especially those that have got the highest prevalence. I think we had just left it, and people were just scamming it. The
reason they couldn't close the border was because of the relationship we had with the Chinese.
It doesn't matter
yes,
about
but then
relations.
after he realized that the situation was becoming so destabilizing and he had to shut the border. So the question is, how many Ugandans traveled before March 17th when the president had the national address? That is the question. And if indeed these people are in the general population and they're spreading the disease, what are we looking at in the next 4 months? Are we looking at a major outbreak in the next 4 months? And if the COVID-19 stays with us, what will be the strain on the medical practitioners in this country?
Yeah, for those who had traveled to these kind of countries, I think the ministry should have a mechanism of tracking them, and they should have the responsibility to report back how long they had since when they had left those countries, if at all they had any other presentations and so on, so that we can also track their contacts. The cascade can be so enormous unless the people should volunteer to give information about their whereabouts, what they have been presenting with, who they have been contacting. And then that cascade should be mopped up with the Chlorine system that we have in order to do the testing and see if at all they are safe. I want to believe that many people, as this epidemic has been already described, incidentally.
It's now a pandemic.
Yes, a pandemic, has been described. Not 100% of the people die. In fact,
109,000 have recovered. Yes.
In
Out
fact,
of the 422,000,
97%.
yes, infections globally, 109,000.
But what I'm saying, if at all you have a population of 100 people, 97 will survive it.
So let's talk about prevention.
So we should not be over scared again, so that we run away even from testing. People should not run away from testing, because it can only be the lifeline.
Let's end this conversation with how best the people, the public, can actually prevent the spread of the coronavirus and contraction, and also the medical practitioners. I'm here grappling with this because I understand someone can come to a medical practitioner complaining about a headache, not knowing they have coronavirus. Now, the unsuspecting medical practitioner will come and maybe interact with this patient, try to do some checks, not knowing it's COVID-19. That is how community spread started in Wuhan. How best can we actually ensure that we protect our health workers in this interim? Should we give them face masks at each and every medical facility?
Yes, that is number one. Every facility should have as many facial masks
and
protective gear as possible. We should have water running at the entrance of your facility with at least soap or any other disinfectant available. Ensure that you are masked, and make sure that you suspect each of the patients that you suspect should suspect you as you suspect them. So masking is going to be very important. The other thing is maintain hygiene as much as possible, social distancing, and continue sensitizing the population about these public health measures that have been given by the Ministry of Health through the head of state. Furthermore, we are telling the state that we are willing to join with them in order to fight this disease. Let them do their part. They can extend more of these facilities. Masks for those people who cannot afford them. We can do the sensitization and distribution. Thermometers, non-contact thermometers, we need them. The government can come in at this critical time. Gloves and either manufacture or coming down for those people who want to exploit the population. These are proactive measures that we think that we can synergistically work together with the state in order to improve the situation.
Dr. Lulume Baiga, the president of the Society of Uganda Medical Practitioners, and he was so kind to make time to speak to us right here morning at NTV on the subject of the coronavirus that is ravaging the country and the world alike. 422,000 infections and 18,000 deaths. However, 109,000 people have recovered. So please do not be alarmed. As long as you have the information, you will be able to actually prevent the spread of COVID-19. If you do away with such myths that are running online, like dosing yourself with chloroquine, it does not work. It does not work at all. Eating garlic, it does not work. You're still watching Morning at NTV. We'll be right back.